Bismillahirrahmanirrahim. Firstly, I would like to thank Government College University Faisalabad for giving us an opportunity to present our research in International Brain and Biomedicine Conference 2023. My name is Dr. Shareena Mehboob, and the topic that I'll be presenting on behalf of my team is Association of Compassion Fatigue, Empathy, and Personality Traits among physiotherapy students and professionals. I would also like to thank Dr. Sonia Arshad, our supervisor, and my group members, Dr. Ariba Khan and Dr. Sayyida Javeria, for their valuable contributions in the research throughout. So the objective of this study was to explore the link between personality traits, empathy, and compassion fatigue in physiotherapy students and professionals. As we all are aware that physiotherapists play a critical role in rehabilitating the irreversible disorder and managing many degenerative diseases. So for any human-related profession, it is really necessary to have caring characteristics such as empathy and compassion. Though we believe that physiotherapists are not the first respondents in trauma, but they are long-term caregivers for the patient. And so we find it very important to discover the psychological aspect of physiotherapists. So our research started from distribution of the questionnaire through social network. So recruitment of the participants was conducted by giving e-survey questionnaires. After 3 reminders, we got a sample of 314 participants, and this was also calculated from the OpenAPI formula of sample sizes. So as we move on to the methodology, so the recruitment of participants started from 500 and we ended up to recruiting 314 participants, out of which 192 were physiotherapy students, while 122 were physiotherapy professionals. So who are our study participants? As we are aware, physiotherapy students and professionals, but the inclusion criteria and exclusion criteria was defined. So physiotherapy students with clinical experience like fourth and final year was included. Professionals having maximum of 8 years of clinical experience. When we talk about sample sizes, as I told earlier, that it was calculated through OpenAPI formula. 3 instruments used to calculate these variables. First was compassion fatigue short scale, another was Big 5 inventory short scale, and third was Jefferson scale HPS version. So the results of the participant characteristics are here as follows. Firstly, 88.5% students were female, while 51.56% in professionals were female. So the majority of the participants were female. Another important participant characteristic was that we divided our students and professionals into 5 groups: fourth year, final year, trainee physiotherapists, and physiotherapists with 1 till 5 year of experience, and physiotherapists with 5 to 8 years of experience. As we move on, we have area of interest. So majority of the participants, the half of the population of the sample size was interested in the OPD setup. Okay, the third thing which we'll be discussing is in results is relationship of empathy and clinical experience. So as we move on to this first chart, this shows that empathy decreases as the clinical experience increases. And when we talk about compassion fatigue, it is 35.5 for students, and for professional it is 45. So we can see that empathy score is more in students, while in professionals the compassion fatigue score is more. When we talk about personality traits, we have 5 personality traits: extroversion, agreeableness, conscientiousness, neuroticism, and openness. Out of these 5, the researchers have proven that neuroticism is found to be the negative characteristic personality trait, while the other 4 were positive. So when we talk about their comparison in students and professionals, so neuroticism is found to be a slightly higher in professionals. So we do not take mean as a central deviation, central tendency, because it can deviate the result due to extreme values. And so median is the best choice for non-normal distribution. Therefore, we have taken median as our central tendency measure. Now, when we move on to the major result, which is Mann-Whitney U test and Spearman correlation test. So when we use this test, we can compare the variables in two groups. So here is the result shown. For example, when we take compassion fatigue as an example, so the value is 0.029 and the decision is to reject the null hypothesis. As we all are aware, the null hypothesis states that there is no difference in variable in both the groups, students and professionals. But our result has found that there is a significant amount of difference in both the groups. And so the empathy score also differ in both the groups. So the personality traits have a very variable view. So now we move on to Spearman's correlation. It is a non-parametric test that is used to measure the association between the variables. So we have three variables: empathy, compassion fatigue, and personality trait. So when we compare these, we can interpret the data in a form that compassion fatigue is correlated with the empathy, but it is negative correlation. So the negative sign here shows if one variable increases, or the value of one variable increases, the other one decreases. But empathy and positive characteristics like extroversion, agreeableness, and conscientiousness, along with openness, seem to be positively and directly correlated with empathy. Positive characteristics like extroversion, agreeableness, conscientiousness, and openness, these are positively related or directly correlated with the empathy. Well, if we see this column of the table, here it is shown that compassion fatigue is related to empathy, which is negative correlation, as we have also seen it here as well. And when we compare it to the personality traits, so we can find that conscientiousness and agreeableness, which are positive characteristics, are negatively related to or indirect relationship to compassion fatigue. Discussion here is what we have found in the current study and what we have found in the literature, how it differs or how much they both complement each other. So the current study result reflected that physiotherapy professionals had a higher level of compassion fatigue and lower level of empathy when we compare to student group. So the professionals were having higher level of compassion fatigue as compared to students, but according to D'Souza and Davy, in 2020, they found that compassion fatigue is more common in young physiotherapists. Another contradictory results were found when we compare that several studies have found that empathy uh, can remain steady, can rise, or can decline. This variable is likely to be related to cultural factors, environmental factors, and curriculum. So our study concluded that there was a negative relationship of empathy with the clinical years of passing. A research done on Indian physiotherapists revealed that compassion fatigue is higher in rehabilitative unit, and then it follows through ICU and OPD setup. While in our findings, compassion fatigue was prevalent in physiotherapists working in rehabilitation unit, followed by OPD and ICU. While when we compare empathy to the compassion fatigue, it was found that empathy was related to more of positive personality traits like agreeableness, extroversion, and openness. But here also we found a contrasting result of another study which highlighted that compassion fatigue was associated with agreeableness and conscientiousness. So what were the limitations of the study? So first was that there was no causal relationship found between the variables. So we cannot say that this particular variable is the cause of the other variable. So we have only founded the association among the three variables, and we have compared them in two groups. The another limitation of the study was convenience sampling and small size sample size. So convenience based sampling and small sample size both limit the generalizability of the results to the whole population. So it is important to note that the results cannot be generalized. Next, we move on to last part, that is conclusion. In conclusion, we can say that the level of empathy and compassion fatigue both differ in physiotherapy students and professionals, and big five personality traits were correlated with the self-reported measures of empathy and compassion fatigue. These are the references from where we have taken our material. And thank you so much for your time. And I wish all of you a very good luck for your future. Thank you.